chemical peels. They obviously do retexture the skin, they exfoliate the top layers of the skin or to reduce the inflammation in case of acne or to treat mild pigmentation, suntan and also. When talking about lasers, mostly it is done to rejuvenate, tone, tighten and also these are usually act on the chromophores, like it can be a water in your skin, it can be a pigment when we are talking about removing the pigmentation or tattoos. Is it safe to combine the laser and chemical peels together? I get this question a lot of times. Sometimes in my prescription also when I write as separate procedures, patient will often ask, Doctor, can I come at once and get all the treatments done? So let's break it down for you today. What is safe and what is unsafe and what can you combine and what is not advisable. I am Dr. Smriti Nathani, plastic and cosmetic surgeon practicing at Tamira Plastic Surgery, Chennai. Let's dive in. It's a great question, but the answer is not just a simple yes and no. There is so much there in between. When we talk about chemical peels, they can be superficial, medium and deep. They obviously do retexture the skin. They exfoliate the top layers of the skin or deep in the case of deep peels, and mostly done either to reduce the inflammation in case of acne or to treat mild pigmentation, suntan and also retexture the skin and little bit of anti-aging when we talk about retinol peels. When talking about lasers, mostly it is done to rejuvenate, tone, tighten and also a little bit of pigmentation problems the lasers can tackle. These are usually act on the chromophores, like it can be a water in your skin, it can be a pigment when we are talking about removing the pigmentation or tattoos, and it can just give a toning which will tighten the skin a bit. Now what is safe? If you ask me, safe thing to combine will be peels first, that is a mild peel, not a medium or deep peel, and then non-ablative lasers. Both are very subtle treatments which when combined together does not give too much of hyperpigmentation, don't give PIH, inflammation is less, but it will give you a nice gentle polished kind of facial kind of effect. Now either or you can also do, if you have times, you can do laser first and then do the peel after maybe 10 to 12 days later, and that I would say you can do a slightly deep peel also and the laser toning after that. What I will not do is a combination of either a deep peel or a medium peel with an ablative laser like CO2 which resurfaces the layer of the skin. That is not a safe combination to go for. Again, if the skin is having active acne, inflammation, any kind of PIH, active suntanning, these are the scenarios where I would not combine two procedures but rather tackle one by one, because these can cause immense inflammation and that will hamper your skin rather than doing good to it. So I would rather suggest that don't go for hurry in these procedures and don't try to force in the treatments, rather rejuvenate your skin step by step, either with mild treatments or by spacing out the treatment so that it will help your skin and it will not cause unnecessary chaos in your skin. So if you ask, my tip for getting the best results for the skin is don't be too impulsive. The skin is gentle, let's treat it gently. The second thing, skin prep is the key. If you have time to prep your skin with a correct kind of home care products which is according to your skin given by a skin specialist, and then go for these treatments, you will find that the whole treatment, the result is much better than in a non-prepped skin. So yes, these treatments can be combined, but what should be combined and how it should be combined, you have to ask your specialist, your plastic surgeon, your dermatologist to combine it properly, not some DIY procedure. If you like the info I have given you today, then don't forget to like, share and subscribe, and also let me know if you want to know more about the products or anything. I will tackle that in the next video. Thank you.